Today, we're getting under the hood of women's health with Dr. Shieva Ghofrany, a board-certified OB-GYN practicing for over 25 years. She has used her own personal experiences as a patient with endometriosis, pregnancy loss, weight loss surgery, and ultimately ovarian cancer to help her really understand women and how we think about our health. She is the co-founder of Tribe Called V, a platform to help women learn about all of the OB-GYN health issues they were never taught. Dr. Shieva is getting under the hood of contraception.
So I am in a traditional OB-GYN practice, which means obstetrician. We are the doctors who take care of pregnant people and those who are trying to conceive, and then gynecologist, which is all the other parts of our reproductive health. And it's the same doctor combined into one typically. So that means that we are really poised to help people understand how to get pregnant, but also, and maybe more importantly nowadays, how to prevent pregnancy. So contraception, again, contraception against being pregnant, is a really valuable aspect of women's health that we absolutely need to talk about more frequently, more vocally, so that all people with uterus and ovaries and women understand how they can take control and really be in charge of their own body. We're at a point, unfortunately, right now at this taping, where there is an assault, and I use that term very purposefully, on women's rights and on bodily autonomy for any of us who have a uterus, ovaries, cervix, all of the parts that we are born with, because certain states are really making it challenging to get contraception and certainly stopping our ability to choose when and how we are pregnant and if we want to continue to be pregnant. So never has it been more important for people to understand this. So they really need to find a good doctor, nurse practitioner, or physician's associate who they can collaborate with to understand the different ways that they can actually stop themselves from getting pregnant. There are many issues with this. There's access to care issues, whether someone works too much, doesn't have insurance, doesn't have access to care, lives in areas that we consider medical deserts. There are educational issues. There are language barriers. So there are many different aspects of contraception that are challenging. But for the purposes of today, I think it's really valuable for us to talk about the different methods of contraception and why they may or may not work for each individual person. When I talk to my patients or anyone even on social media about contraception, I really ask for a level of maturity, I call it, which means I will help you understand the different types of contraception, the pros and cons of each one. But what I need from the populace is to understand that there's no one right way to use a contraception, meaning there's no one particular contraception method that is going to work for you necessarily over, your friends or your mother or your sister. So you might need to try a few. And as your body grows and evolves and changes, you might need to change the one that you're using. And each time you try a new one, it might take a couple of months for your body to get used to it and accommodate. This can be incredibly frustrating. But if we don't preemptively tell people that, then they're immediately frustrated. They think their provider is not listening, and they're apt to actually stop their form of birth control, which is not what we want. So I ask at the beginning of the process, let's talk about the different forms. Let's understand the pros and cons for you individually. And let's also please accept that your body is going to go through a period of adjustment. And that is unfortunately something that we cannot control. And a little bit of it is trial and error. And if we don't accept that from the beginning, then we're going to be frustrated together. So let's instead try to figure out the best method for you over time. A lot of different types of birth control or contraception, we call it. So the most common that many people know of or are what we call combined hormone contraception, which would be the pill, the patch that you stick on your skin, or the ring that goes into the vagina. Something, for example, like this. This is a model of a vagina, and there are plastic rings that can go actually into the vagina. So those are combined hormone contraception, and those work by getting into the system, flattening out the hormones essentially, and evening them out so that you don't ovulate. And that's the method with which they stop you from getting pregnant. There are other hormone forms of birth control, for example, an injection of progesterone, an implant of progesterone, or intrauterine devices. An intrauterine device, an IUD, is a little apparatus that goes up into the cavity. It's shaped like a T. It's actually very small because our uterine cavity is small. And there's two general forms of that. One that just has a little bit of copper wrapped around this little plastic T that stops the sperm from actually getting into the uterine lining. Or the other form has progesterone in the actual plastic to thin out the uterine lining. So IUDs are actually a really amazing form of birth control that I think increasingly are being adopted. And then there's certainly female and male condoms. Most people know about male condoms. They might not have heard about female condoms. And those are what we call barrier methods, which are very valuable because outside of contraception, they also are the only way to decrease the risk of sexually transmitted infections. And then on top of it, there are newer varieties of certain things like spermicides that can work. Spermicides in general will never be as effective as hormone contraception, intrauterine devices, or even condoms, but some people choose to take that risk. And I actually also like to add withdrawal as a method. I would never advocate for withdrawal or what people call pulling out, which is where the penis gets pulled out immediately before ejaculation so that the sperm don't get into the vagina and into the cervix. I wouldn't advocate for it as a very effective form of birth control, but if we're being complete about all of the spectrum, we need to include that because it is what some people are using and they need to understand that it is not that effective, but they may choose that risk profile. In other words, each of us can and should understand what are my options? What is the odds of getting pregnant based on me forgetting to use something or not using it correctly versus the error of just the product that I'm using, like an intrauterine device, versus pulling out? And am I willing to take that risk? And only then can we really have a great conversation where people recognize that they do have choices and that they need to be in charge of whether or not they get pregnant. And we really, really are at a place where we need people to try to intentionally avoid pregnancy if they don't want to be pregnant, especially given what's going on in our country with regard to abortion and reproductive rights. The good news and bad news is that there are myriad pros and cons to every form of contraception. And there's no way for me to tell any patient this is the one best form of contraception for everyone, or even the one best form for you necessarily until I understand what issues you have outside of not wanting to be pregnant. Because first of all, certain forms of contraception are more likely to be successful. For example, an intrauterine device does not require you to do anything other than go to your doctor, certainly withstand a certain amount of discomfort, but then it is in and it is very, very, very effective. But if you get pregnant with an intrauterine device, there is a small risk of an ectopic pregnancy, a pregnancy that grows outside of your uterus. So that's, for example, important to know. If you have very heavy, painful bleeding and you have pain during ovulation, or you have a history of endometriosis, you might want a hormone contraception that is going to stop ovulation because that will really control all of those symptoms that we talked about. If you happen to get a lot of acne or a lot of mood changes during your cycle, then the intrauterine device is not necessarily going to help that because it doesn't get into your system. It merely provides local birth control. And again, a combined hormone contraception might be what you need. On the flip side, prolonged use of these combined hormone contraceptions sometimes causes decreased libido, vaginal dryness, and some women just don't like how they feel because from the emotional perspective, while they might be more even, they think they feel more flat. On top of it, there are certain risks with regard to estrogen. So for example, the estrogen that is in the birth control pill or patch or ring can increase your risk of high blood pressure and your risk of blood clot and stroke. It's a minimal risk, but it is something that people need to know, especially if they're older and smoking. So again, there are pros and cons to many of these, which is why it's not a quick, easy answer, which is why it really requires you to have a good conversation, either with your doctor or your other providers. Nowadays, there's even telehealth, but it really means that you deserve that back and forth conversation to ask all of the reasons why you might be taking one versus another, and be patient because your body might need to get used to it. When patients talk about birth control with me, I often ask them not just about their level with which they don't want to be pregnant. And I kind of phrase it as, if pregnancy would be devastating, then we need to make sure we're picking the most effective forms of birth control, which typically would be pill, patch, ring, intrauterine device. And another one that we didn't even touch upon, which is surgical sterilization, where we remove the tubes or block the tubes. So first, I want to know their threshold of, do they want to be pregnant in the future? And if they don't want to be pregnant in the future or now, how much do they not want to be pregnant? Because that might change how I direct them. The other aspects I really want to know about are, how is their cycle? During their period, is their period regular or irregular? Is it heavy? Is it painful? Do they get pain during ovulation? Do they have other symptoms that relate to the hormone changes? For example, mood changes during the middle of their period or right before they get their period? Do they get a hormonal headache right before their period comes? Do they get acne or irregular hair growth? These are all things that various forms of birth control can either make worse or can help. And so just merely behaving as if the IUD is great for everyone because I used it and I loved it and everyone should use it is really the wrong approach. But I hear that rhetoric often from doctors and patients. So again, it's really important for you to think of this as not just contraception, but what are the other non-contraceptive benefits or risks that I might need to know about that can help or hurt me? Many young women really like combined hormone contraception options because they're very easily reversible. If you start a pill or a patch or a ring and you don't like it, you merely stop. There is not a weaning process. You don't need to come in to see the doctor or provider. So that can be really valuable, especially because many young people, when they first got in their period for that first couple of years, they might have heavier bleeding, they might have painful bleeding, they might have mood changes or acne. And those are all things that by suppressing ovulation, through these combined hormone contraception methods, we can really help that. On the other hand, many young people feel that they don't want to have to kind of take something every day or put something in their vagina or put on a patch. They don't want the side effects of suppressing their ovulation. So they're increasingly interested in intrauterine devices, the IUD. Historically, back in the 60s and 70s, during the sexual revolution, the IUD was often used because women were starting to embark on more robust sex lives and they really needed contraception. The upside being we had this valuable tool with an intrauterine device, but the downside was that condoms were not encouraged. And so many women were having multiple sexual partners, unfortunately getting sexually transmitted infections like gonorrhea or chlamydia. And the IUDs back then were a little bit different shaped. And so they were unfortunately a receptacle for the bacteria. So many women were getting very sick with pelvic inflammatory disease, something we called PID. That history has trickled in a little bit where a lot of older mothers will still say, I don't want my child to have an IUD. I remember all those horror stories, but it's really valuable to know that IUDs have come a long way. They are formulated differently. The shape is different. The ability to insert them a little bit easier is different, and our knowledge of the fact that this doesn't have to do with whether you have multiple sexual partners or you have one sexual partner. You need to know that your risk of chlamydia and gonorrhea goes up slightly with an intrauterine device. Therefore, you have to be as monogamous as you can be and make sure your partner is, but that's not always predictable. So you might need to use a secondary method like a male or female condom to stop the likelihood of getting these infections. Nonetheless, the intrauterine device is really increasing in popularity, which I think is actually wonderful because if used appropriately, really, it can be a much easier tool because you don't need to go back and forth to the doctor or the pharmacy, especially at this time where we're worried that not only are abortion rights on the line, but we're increasingly seeing that contraception really is being curtailed in certain states, either because insurance companies aren't covering it or because certain states really are considering things like the pill, the patch, the ring as what they call an abortifacient, where these might indirectly be causing an abortion, which they are absolutely not. It's very important for people to know that that is not true, but that is what many of these politicians are saying and trying to remove contraception rights. So never has it been more important for people with uteruses and women to understand that they need to be in control. They need to know their options and they need to have the most effective form of birth control and potentially even two forms of birth control. Two pieces of advice. One is if you are having sex with a man or someone who is ejaculating sperm, and there's no way to say it in a more elegant way than that, but please use contraception unless you intend to get pregnant. I recognize that there are so many barriers right now that many of us of privilege can't even completely contemplate, but to the degree that you can, please try to plan your pregnancies because we are increasingly in a world where we might not have the right to be able to terminate the pregnancy. And even as someone who is very in support of choice, I also would say the ideal would be that we only need to use that choice when there truly was a circumstance with a significant anomaly or something like rape. In all these other cases, if we can really try to plan our pregnancies and avoid unplanned pregnancies, that would be excellent. So that's one broad piece of advice, is please take control of it yourself. The second piece of advice, when you try to take control of it with yourself in finding a good doctor or midwife who's going to instruct you with it, is to be patient with the process and to know that your experience can't and shouldn't be extrapolated to everyone else, nor should there to you. Meaning, you might hear from your sister, your best friend, your mother, they loved the IUD. Everyone should be on the birth control pill. No one should be on the birth control pill. But none of that is actually true. All of these forms of birth control have a lot of benefits, and all of these forms of birth control also come with risks. So only you will be able to help understand which one will work best for you at this time. And maybe that changes every couple of years as you change. So you really need a good provider who's going to help you understand the pros and cons of each one.